Hello, everyone, and welcome to another video in our lecture series. So we're going to be talking about understanding social determinants of health, or SDOH for short. And essentially, we're going to be talking about how our environment shapes our health, right? So we can think of our environment as the land where we're living um, near. We can talk about our physical environment, um, social environment we're speaking to, but we're going to get more into detail about what environment really means and how does this shape our health. All right, so before we delve into the social determinants of health, um, I'm just going to let you know that we're going to be developing a video, or I'm going to be developing a video about what the biomedical approach is. So stay tuned for that. But this is already a disclaimer here. The social determinants of health takes a completely different approach to health. And you can think of the biomedical approach as what really Western medicine has been emphasizing. And, it already states it in the word biomedical. It takes a medical perspective, a biological perspective to health. And so we're really focusing um, just on the biology of the individual. And then we also provide medical um, services or medical interventions to actually address the issue of poor health. So whether that be, again, medication, as we see on this image on the right, a bottle of pills, right? So biomedical approach is a completely separate approach, right? But it's with a lot of Western medicine. When we're talking about Western medicine, what I mean by this is the Western culture. So in North America, this has been the approach that Westerners have been using, for a long time. And you might have, based on your culture, where you're living, based on your religion, you might have a different approach to what health means, right? Um, you might practice medicine, or your family, or if you have a traditional faith healer, or outside of the normal physician or doctor that we have in from a Western perspective, you might have a different view of what health is, right? So I'm just here to introduce um, what are the different types of ways we can view health. So one of which is the social determinants of health approach, but also the biomedical approach, which again we'll be discussing in a different video. But essentially, these are just ways that people view health, and it's through history we can, get a glimpse of how people treat diseases and illnesses. What are the different interventions? What are the different treatments and approaches that people have and society has for treating different conditions, whether it be um, an illness of like a physical lesion, right? Which would be like um, a scar or like a tumor, a visible tumor, right? How do we treat that, right? But there are also illnesses that might not be um, as obvious, right? Mental illness, mental health, it's more complex. And so, again, before we talk about SDOH, I just want to mention that the biomedical approach that has always been, the traditional way of thinking about treating diseases. And again, this is from a Westerner's perspective, North American perspective, which really focuses on diagnosing and treating diseases at the individual level, right? So, a patient comes in, they have a visible tumor, we do surgery, or if someone has cancer, we provide chemotherapy as, one option for, essentially as a health outcome. It's not always a cure, but in a sense, this is what we do to take care of this biological process. Um, and so again, the focus is on the biological and physiological process that of illness, right? When we're really focusing on the biology. What is a tumor in biological terms? It's a lesion, right? What it's or it's an when we think about what tumors are, it's uncontrolled cell growth, right? The cell is growing. And so we focus in on and zoom in on that purely biological and physiological process. And again, there are a lot of limitations to this, right? It does not address the underlying social factors contributing to health. And so again, this is where the social determinants of health is going to be important, right? So, and an example of this would be treating someone with diabetes, right? So I gave an example earlier about cancer, a cancerous tumor that's, visible. We can see it with the naked eye, treating that with chemotherapy. But we can also treat someone with diabetes, with medication, right? Give them medication, right? If someone has type 2 diabetes, for instance, which is, a leading cause of illness in the United States and around the world, in Canada and the Philippines. When we're treating this illness, this condition with just medication, that's taking a biomedical approach because we are not addressing other factors such as diet, exercise, and even living conditions. And so that's what I mean. We have to really step outside of this biomedical approach, which a lot of physicians have are currently taking right now. Although a lot of medical schools, a lot of hospitals are incorporating the social determinants of health in their clinical practice, there are still a lot of physicians who are still focusing in on the biomedical approach that we can only treat the disease and the condition purely with medication or a medical intervention, whether it be right surgery or a process of chemotherapy, right? So again, we are not addressing anything else. We're focusing in on the biology, right? The physiology, right? And so that's just a disclaimer. But again, we'll talk about this in a separate video, the biomedical approach. Okay, so let's now get into the SDOH, or the social determinants of health. This is an image that I got from CDC, the Center for Diseases and Control in the USA. They're a leading health firm in the US, and their primary role is disease surveillance and response. So they're a national level disease firm or organization, whatever you want to call it. And they made this diagram about the social determinants of health. And again, it's a very, very general diagram. But we can just see how in the center we have groups of individuals, populations. You can think of yourself as this one person, or you can think about, a group like your family or your school, your workplace. But essentially, your health is affected by all these different factors. And again, it's social determinants. They're socially constructed. It's a social factor. So it could be like education access, right? If you have education, if you have access to education. And remember in my first video, I talked about how education is really a privilege. Not everyone has the same access to education that you or I might have, right? And so we have to address how this actually impacts the rest of the population that don't have access to education. Or they might have education that may be of poor quality, right? So let me just get a laser pointer here. So, right, we can talk about someone who has education, but also the quality of education, right? Do you have education? Yes or no? But also, is it the quality of your education sufficient? Is it good, right? So, you know, and that can impact your health. But also the type of healthcare you get and the quality of healthcare can affect your health as well, right? It's also a question of, do you have access to healthcare? Um, that's really the first step. Does your country where you're living in right now have some sort of universal healthcare act, or maybe a form of socialized medicine like we have in Canada? Um, or is your is the health system really built on being a commodity, on health services being a commodity, a good? And that's something I had briefly mentioned in my first video. So, and an example of this is the United States, right? Healthcare is a commodity, right? You pay for services and you get the services. You need to have money, right? So even having healthcare is a problem, right? Some people have no access to healthcare, and some people might have some form of healthcare, but the quality might not be as good, right? And so that can impact your health, right? So, and again, when we're just talking about healthcare and the quality of healthcare, we might think of it as, a biomedical approach, but it actually is more of a social approach because healthcare can vary in different countries, in different socioeconomic settings, right? So you might be in a more developed country, a rich country like the US or Canada, or you might be in a developing country like the Philippines, or even right in any of the low and middle income countries, right? But again, the type of healthcare you get and the quality is not really directly related to the biomedical approach. It's more of the differences in which can be a social aspect. It can be a political aspect. It can be an economic aspect, whether your country can actually afford to have good quality healthcare. So, I'm talking about the social determinants of health here, but the social determinants can actually be expanded to think about political dimensions, economic dimensions. But I'll get to that in a different video, right? But this diagram is really giving you an overview of what actually impacts your health. The neighborhood and the built environment can also impact your health. Do you live in a neighborhood that has a lot of buildings, high-rise um, buildings, or are you in a rural area where you don't have access to a lot of clean drinking water, right? So where you live impacts your health outcomes. And when we talk about the built environment, we're talking about the environment that is built by humans, right? Whether it's urban, it's a case of urban design and urban planning. Um, how is land used, right? Land use, right? How is the land divided in a certain country or setting in a city, right? Do you have a lot of um, grocery stores that are near your house? Do you have a lot of facilities where you can do a lot of exercise in your area? That's what I mean when we talk about the built environment and your neighborhood, right? A lot of neighborhoods are different. And there's also a video that you can watch. It's called Cooked, and it talks about it's called Cooked Survival by Zip Code. That's a video that just shows how and this is done in the United States, how your zip code or postal code and where you live, even if it's, a few kilometers or miles apart, can actually impact your health outcomes, your life expectancy, right? So that would be a good resource to watch. So again, your neighborhood and built environment can impact your health, but also the social and community context, right? Who are you living with? Do you live with someone? Do you have family? Your friends? What do your friends and family believe about health? Um, and what types of behaviors do you practice together? And how does that impact your health, right? And so really, when we talk about social determinants of health, we're not really trying to point anyone out, right? We're just trying to explain what you do and how that affects your health, what you do as an individual, but also how your environment affects you as an individual, right? So, I can give an example of a group of teenagers, drinking alcohol, binge drinking, drinking a lot of alcohol, and how that leads to their poor health outcomes. And that can be, under this umbrella of social and community context, right? But other factors are actually much deeper. There's a lot of research that goes into these other factors, which I'll go into. But again, a lot of factors. And finally, economic stability. So, do you have enough money? How does money affect your health, right? And you can actually connect these different things. So again, when we talked about healthcare and quality previously, if we have, for instance, the United States, excuse me, where healthcare and quality really depends on if you can afford it or not, right? That really relates to economic stability, whether you can actually afford to have healthcare. Because in United States, in this country, healthcare is a good, it's a commodity. And so you need to have money for that. So a lot of these different factors, they're not, single factors that, exist in their own domain. There's a lot of interaction and interrelationship between that. And all of these factors, they actually combine to create your health outcome. Okay. And so what are the social determinants of health? And we can go into the definition. So the social determinants of health, they're really the conditions in which people are born, grow, live, work, and age. And so it's a condition, right? We are living in a condition, whether you live in a city, an urban environment, or a rural area. Really, the social determinants of health explains these conditions, right? And they really affect a wide range of health outcomes, right? You're functioning. Can you actually do exercise and physical activity in the area that you live? Can you even go outside for 15 minutes and actually feel healthy and feel that you can actually breathe fresh air? Or are you outside for 10 minutes and you can't even breathe? The air is so polluted and you can't function. So a lot of these things affect your health and your functioning, right? And it again affects the quality of your life, right? So we have a lot of when we talk about the quality of life, we usually talk about life expectancy, right? The amount of years on average that members of a community may live, right? So I'm just gonna give these numbers off the top of my head. You can do verifying just to make sure it's accurate. But for instance, the life expectancy in Canada is about 80 years old. In the US, it's about, I believe, 75. And then like in the Philippines, it's about like the high 60s to 70s. But again, this is what we when we talk about quality of life. We usually talk about this in terms of life expectancy, the amount of years on average that a person living in this type of environment, lives, on average, how many years, right? And so examples of social determinants of health, as I've already mentioned in the previous slide diagram that you've seen, is income, right? Your financial stability, how much money you get, education, whether you have access to it or not, housing, where you live and the environment, right? And your access to healthcare. These examples really affect your health outcomes, right? And again, this steps outside of the biomedical approach that I had previously mentioned, right? Because we're stepping outside of the individual's biology, the individual's physical physiology, and actually explaining health outcomes, why they're experiencing poor health with these other factors, these other social factors or determinants. Okay. And so you might say, why does the social determinants of health matter? Why does SDOH matter at all? Why do we even talk about it? Why is it discussed in a lot of classes? Why is it talked about in some medical schools? Why is it important? Okay. So the SDOH really has a really big impact on health outcomes rather than medical care or even the biomedical approach. It's the acknowledgement and the understanding that social determinants play a bigger role in determining health outcomes for individuals and large populations. And so when we step outside of this purely biomedical model, we see that the social determinants of health actually has such a big impact on these poor health outcomes that we see. And that's why it's important, as studies show that 50% of health outcomes are actually influenced by social and environmental factors, right? And it's this interaction, right? Like the previous diagram that I showed. When you have all of these factors interacting, and I'm not saying that, you know, we that the biomedical approach is something that we completely ignore. No, no, no. We actually have to take into consideration the social determinants of health on top of the biomedical approach, right? Because the biomedical approach looks at physiology, but also your genetic makeup, right? Who are your parents? Do they have history of high blood pressure or heart disease or diabetes, for instance, right? Genetics can actually play a good role in in actually seeing and addressing these poor health outcomes. We can see there's a genetic map that we can see how disease is transferred through generations, right? And that's using a genetic lens, right, through a biomedical framework. But I'm not saying that we should completely reject the biomedical approach. I'm saying that we also need to consider the social determinants of health. As again, studies show that 50% of health outcomes are influenced by this interaction between social and environmental factors, right? And we'll talk about that in a bit. And again, it's important because, when we improve health outcomes in these communities, SDOH can actually lead to better health for, an individual, you and me, and the larger community as a whole, right? When we really focus and think about what are the social determinants in my community, whether I'm living in Canada, in the United States, or the Philippines, what are the social determinants? What's impacting my health, right? I've lived in Canada for nearly 20 years. So, there's a lot of things that impact health, right? I've lived in Winnipeg. It's very cold. You can get sick if you're not, properly dressed. And then I moved here to the Philippines to work on global health work, and I can see that there's a lot of urban air pollution, which actually affects my own physical symptoms, right? Because I have like a very minor form of asthma. So it's hard for me to breathe. I need to wear a mask. And so your where you live can actually impact your health, right? And so that's why I'm trying to stress the social determinants of health approach. Because when we improve the social determinants in your specific community, in that specific context, it can actually lead to better health again for your own specific community, right? Because it will vary. And so I'm just going to give a broad overview of the key categories of the social determinants of health. You've seen the first diagram in the previous slide, but here's a little bit of a summary of these key categories. So we can look at the financial aspect, your economic stability. Are you able to survive in your environment, in your specific environment where you're living right now? Right? What's the minimum wage in your area? What's the national wage? Are you making enough? Are you making enough on average? Um, or are you living below the poverty line? Are you struggling to afford living in your country? Are you struggling to afford expenses, right? And that's an income problem, but also there's a job security problem. Do you have a job? Is your job um being paying you well enough to actually survive, to actually afford basic needs and essential goods in your country, right? Because you could have a job, but it might not give you the security. It might not give you even access to healthcare, right? Since a lot of companies have access to insurance coverage for its employees. So, having a job is one thing, but does your job provide you with an ability to access good health care, health insurance, and economic stability, right? That's an important aspect too. Or and poverty, right? Not having enough money, not being able to survive, and living below the poverty line or on the poverty line, that's a problem. That can impact your health. The second aspect is education again, access to education and quality. Your schooling, does it provide you with a lot of knowledge? Does it allow you to get into jobs that actually help you in the long term, right? Because we think of education as a key, the key that unlocks many opportunities, right? And sometimes education is really a determinant, right? If I don't have education in a country where education is actually a prerequisite, it's a mandatory thing you need to have to actually access a good paying job or good opportunities, then I can't access those things, right? I don't have the key. And that will affect my health, right? Because I might not be literate. I might not have good literacy. And what do I mean by literacy? It's your ability to understand, comprehend, understand the knowledge, and also, it's not just reading and writing, but also being able to apply that in your job, that understanding. Um, and again, this is education is really a process of lifelong learning, right? There are people that will start in, middle school, high school, they go to college, and then they maybe take a master's degree and then a PhD. But after the PhD, you're still doing research. So it's a process of lifelong learning. And really, when we talk about this as a category within SDOH, it's really asking, do you even have access to this education? And is it a good quality education? Right? Because again, understanding that education is a privilege. Not everyone has that same access to it, right? We need to address and understand this, right? Because it's actually direct impact to our own health, right? And so again, many people in the world don't have access to education. A lot of people haven't finished middle school or even kindergarten, right? And that's a problem because education is a key for us to access all of these jobs and opportunities, right? Without education, it, someone might not be able to read or write or even watch this presentation and actually understand. They won't be able to watch this at all and understand it if they don't have education, right? And they won't be able to practice good health behaviors if they don't even understand what good health means, right? So that's what I mean by education being a key category of the social determinants. And that brings me to three, which we've talked about: healthcare access and quality. Do you have access to healthcare? And the second question is the access to healthcare of good quality, right? Is it available in your country, a good health system? And can you afford that healthcare, right? And again, you need to connect back to these things, right? If you don't have economic stability, if you don't have access to education, you might not, you know, understand what healthcare access is or what it means to go to the doctor's office, right? So they're all connected. They all overlap and interact with each other, right? So again, this is really a thing that's specific to your own country where you're living, the region, and it can involve a mix of politics of the country, the economic landscape of the country, and whether your country is more developed, a less developed, or a developing country, right? So a lot of these factors are really dependent on where you live and these intersections. The fourth key category of SDOH is the neighborhood and built environment. And again, where are you living? What type of neighborhood are you living? Is it safe to live in this neighborhood? And I'm going to give you an example of that film that I mentioned earlier, the Cooked, Survival by Zip Code. When you watch it, you'll see that, and this is in um, the United States, the African community that's living in this neighborhood, in this one area, they're actually boarding up their windows. They can't use their air conditioning. They can't even get fresh air because they have to board their windows since their neighborhood is very unsafe. There's a lot of crime, a lot of violence, a lot of gun violence. So that's what I mean by your neighborhood. Is it a healthy neighborhood? Is it safe to go outside, right? Is it safe to breathe in the air outside? Can you actually exercise in your neighborhood or not? Or do you have to be locked up in your house? So that's your neighborhood. But also the built environment again. What is the built environment? It's what we build, what humans build for different environments. So how long do you have to walk to get to an exercise facility or a park? How long do you have to walk to get to a grocery store or a supermarket? Or do you even have those in your neighborhood because of the built environment, right? And again, that's a problem if you don't have these things that actually support your health and well-being, right? Access to healthy food, right? If you don't have access to healthy food, then that's a food, um, you're considered food insecure, right? There's a lot of communities right now with food insecurity because they don't have access to healthy food. And that's again a result of their neighborhoods and where they are and because of the built environment. We create these environments, right? And by we, I mean those who are planning, urban planners, the governments and the countries. They're the ones who are facilitating how many grocery stores are in what neighborhood, it's and what how many parks are built. And it's really more of an urban planning and governmental level decision. So again, I'm just showing you how these all influence your health. Transportation, housing, right? Do you have access to good housing, or are you living in a tent? Are you living on the streets? Are you homeless? Transportation, do you have access to good transportation? Do you have access to any transportation, or do you have to just walk? There are many communities that are living in rural areas. Even here in the Philippines, they don't have access to transportation. They can't access a hospital or a health center just because they don't have um, a means for actually going there, not even a bicycle. And you have to think about these issues, which actually influence health outcomes. If someone can't go to a doctor or see a doctor or see a nurse or get a vaccine or medication, then that's a problem for their health, right? And that's again a result of their neighborhood and built environment. And again, safety, that's something I mentioned, which again is in your built environment. If you, like the African American communities that were in that featured in the film Cooked, um, if you have to board your windows shut because of gun violence, that's a safety issue, right? You can't get fresh air. And so what happened in those communities from that film, they had passed away in their homes because they couldn't open the airs for fresh air and cold air to breathe. And they don't have enough funds to actually purchase an air conditioning, right? So it's a problem, right? Your neighborhood and built environment. And finally, your social and community context. So I gave an example earlier about teenagers, who are drinking alcohol, but this can be, there can be peer pressure in this environment where, they're drinking and driving, right? And that's a concern to public health because, you know, it it's a risk to other motorists on the road. So and why I mentioned social and community context is that your social support network, your community relationships, they're important because your group dictates what you believe. Sometimes it doesn't dictate, you might have a separate view from your family or your friends, but most of the time, who you hang out with, you might have heard this before, but who you hang out with determines who you are and who you become and what you do, right? So you might have, negative social support networks or negative relationships with people that actually impact your health, whether it's your physical health, like those teenage guys who are drinking alcohol and driving, or whether it's a mental health impact, right? So that can really affect it, right? If you're isolated in a community, you can't talk to anyone, not even a doctor, that will affect your mental health. Sure of that, right? So a lot of a lot of these things can actually impact your health, right? Your economic stability, educational access and quality, healthcare access and quality, the neighborhood and built environment, and again, your social and community context, right? So these are the key categories of SDOH, right? Let's dive deeper into what all of these mean. Economic stability, again, this is your financial stability. It affects your access to nutritious food, right? Fresh vegetables, safe housing, and healthcare, right? And your finances, can you actually afford nutritious food? Can you afford healthcare? Can you afford safe housing, right, in a healthy neighborhood? And really people, and this is because people in poverty, the focus of number one is the people in poverty, right, for economic stability. people in poverty often experience worse health outcomes, right? And so this is really important. Poverty, there's a lot of homelessness. And for example, in the Philippines, low income families really struggle with malnutrition for parents, but also their children, right? So if you're of a low income family or you're living below the poverty line, so there's a lot of people in the Philippines who are extremely poor, but there's people in this cohort who are ultra poor. And I believe the definition for that is you're making less than um 10 to 15 US cents per day, right? So, your income, your economic stability impacts um your health outcome, right? Being in poverty. So in the Philippines, malnutrition. So this is a health outcome, a health factor that actually contributes to disease, right? A malnourished child who doesn't have sufficient nutrients in their diet will get sick. And unfortunately, it may lead to mortality, their death, and severe illness and limited healthcare access, right? They can't access healthcare. Although in the Philippines, we do have a Universal Healthcare Act, but not everyone has the same or experiences the same level of access, right? Because of other barriers like transportation, like we mentioned. Okay, number two, education access and quality. So whether you have education or not, and if you have good quality education or poor quality education. Our research shows that higher education levels are linked to better health outcomes. So I don't have to persuade you because it's already out there. It's in our research. You can Google it up, but this is a fact, a true fact that higher educational levels are linked to better health outcomes. And, the lack of quality education really limits these opportunities, right? So, again, if you don't have access to good quality education, then it really limits your opportunities for living a healthier lifestyle, right? So you might not understand what a healthy lifestyle means, what a healthy diet means, what healthy physical activity means. And that can be, again, due to lack of quality education. You might not be able to have good quality education that gives you a good job or good opportunities, right? And an example of this is children. Um, so those who complete higher education in the Philippines actually have better awareness of hygiene and nutrition, right? So from children who have completed higher education, they're more aware. They have better awareness of hygiene. So what do I mean by hygiene? And nutrition. What do I mean by nutrition? Proper hygiene, hand washing, um, being clean, right? Cleanliness. That really leads to a reduction of disease and spread of infection, right? Because if we're practicing good hygiene and sanitary measures, then we won't get sick. We won't get illnesses like diarrhea or hand, foot, and mouth disease. Okay. And nutrition, right? So children who have completed higher education have better awareness of nutrition. What does it mean, right? They're more aware of what food to eat, what nutritional benefits to gain from that, like eating red meat, which contributes to iron. Children have more awareness of nutrition, whereas when you look on the opposite spectrum, those who don't have higher education are often malnourished, right? They have iron deficiencies. They don't have enough iron in their diet, not enough meat. Vitamin deficiencies, right? Whether it's iron and vitamin A, B, vitamin C in oranges, right? So again, your education affects your health. Third, healthcare access and quality, right? Do you have access to healthcare, good healthcare or not? Is it good quality or not? And again, this can actually be related to the previous things that we've talked about, the economic stability, if you actually have enough money to afford it, Or number two, if you have good education, that actually allows you to access healthcare and access to affordable, or healthcare access means access to affordable quality healthcare, right? And what do I mean by quality healthcare? It's actually healthcare that reduces preventable diseases. So if you have a good healthcare system, it will actually treat you from your disease, right? So it's pretty straightforward. Um, Many rural communities often have limited access to healthcare services. And this is really the case in the Philippines, for example. Many communities can't access healthcare because of transportation issues. It can be educational barriers and literacy that we've discussed previously. If they're not able to understand the physician or even the nurse who is trying to explain that you need to get this medicine or get this vaccine, this is a barrier to them. They can't access this healthcare. They might not trust them because of lack of education, right? For instance. And so those in rural communities are really affected by healthcare access. And again, this is what I just mentioned, that many communities in the Philippines have this limited access. This is a barrier to them. These primary care healthcare facilities, which are usually smaller in nature, but they have all the basic services um, to improve health outcomes. So number four, and that brings me to number four, which is neighborhood and the built environment. And I know we've talked about this previously, but what it means is that where you're living, your house, your neighborhood, do you have safe housing? Do you have clean air? Do you have reliable forms of transportation? Right? These impact health outcomes, right? Whether you have a grocery store that's nearby, whether you have a park, whether you can actually go outside or even open a window, right? Is it safe? Right? That impacts your health. But also, again, poor living conditions leads to increases of risks of accidents and diseases and death, right? If you're living in a poor environment where there's lots of cockroaches, there's lots of rats, um, there's lots of you know, disease then, right? Right? Mice and cockroaches, they spread disease. They're carriers of different types of diseases, which can actually impact your health. So if you're living in a poor environment, a poor neighborhood, a poor house, poor living conditions in your house, an apartment or apartment, then it actually increases your risk for accidents and diseases, right? If you cannot live um in your house because there's so many sharp objects as well, right? Tripping hazards. There's exposed nails on the floorboards, and you can get an accident. You can it's really unhealthy. It's a poor living condition. And so an example of this are communities in urban slums. In a slum is right when you think of what a slum is, an urban slum, it's a group of makeshift houses, and you can think of it in a city, but you know, communities in the Philippines actually struggle with this issue of slums because it's a form of informal housing. And then they can really face a lot of challenges, especially when you have multiple families living in these slums. There's a lot of overcrowding, which can result in a lot of sanitation issues, right? And higher likelihood of disease spread, right? So this is a challenge not just for the Philippines, but also around the world. There are many areas with slums, but also areas where there, aren't any houses. People are, living you know, in outdoor areas, right? Where they're more prone to disease and encounters with um, animals, right? For instance. And that brings me to the fifth point, the social and community context, which, I gave an example about. Having strong social ties and supportive communities actually improve your mental and your physical health. And that's a fact. This is from a lot of studies. Um, And because isolation and discrimination can lead to increased stress and illness. If you're in an area, in an isolated area where there's a lot of discrimination, a lot of hate, a lot of violence towards your group or your community, it can lead to a lot of stress and illness, right? So there was a study before. I'm not quite sure what study or who the author of the study was, but they found that there's an increase in those African American communities that are living in certain neighborhoods that and what happens is that it actually led to an increase in their heart um high blood pressure rate, which increased their risk for heart disease. And this was in an African American community. And this is just because of the stress in their neighborhood, feeling this form of discrimination and racism in their community actually led to increased levels of heart disease because of raised levels of heart or blood pressure levels, right? So that was a test that was done, a physiological test. So again, discrimination and even isolation um, can lead to increased stress and illness, right? Another example is that there are many isolated communities in Japan, for instance, those who are living, elderly who are living, it's kind of sad, but there are a lot of elders that die, um, and in their homes alone, and they're there, their bodies are there for an extended period before actually anyone finds out that um, there's a deceased person in the house. So again, isolation, those individuals who passed away in their homes without anyone even knowing. They may have experienced a lot of stress and illness and disease before anyone actually discovered their dead bodies. So as sad as it is, these things can actually affect your health outcomes, right? Especially if you don't have strong social and community ties, even if it's your family unit, your basic family unit. Another example are Filipino communities. So we as Filipinos, we really focus on having strong family ties, right? And really this social support leads to a lot of good experiences, right? With better mental health outcomes. So we Filipinos, we like to make a lot of jokes about, when we're in school or when we're in work and we're a bit stressed out with work, we're just like we would say, kayanin mo na lang yan. So it's like, just fight it, fight through it. You can do it. It's like and this is again with the strong family ties. We're just trying to support our own communities, our own families, because again, everyone experiences poor mental health outcomes at some point. Because we live in a society where most of the time it's work, 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 study, 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 work, 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 right? And I always say just be careful that you're not making your work your life. You should always have a separate um you should have a work-life balance, right? So again, that's just an example of how your social cohesion, that's another word for this, um how your social cohesion can actually strengthen your um health outcomes, and I could be referring to mental health, right? And physical health. Like if you're with if you're with an active group that's always exercising, then that can lead to better health outcomes. But at the same time, if you're with a group or maybe your family, where you're just sitting and watching the television, you're just eating a lot of chips and you're not moving, you're just staying inside. Sorry if I'm not trying to point anything out, but that's just an example that I had. But yeah, so not to point or put anyone on the spot right now, but that's just an example of how your community, your social context can actually influence your health. But a lot of people, yeah, I guess we've all been guilty of that at some point, having, sitting on the couch watching chips and television. So I think it would be, yeah, I don't want to point fingers at anyone, but I think everyone's all guilty of it. But anyway, so to the next slide. How does social determinants of health really create health inequities? So when we have unequal access to social determinants of health, right? So if people are not having, access to good education, for instance, or access to good quality healthcare, that means we have an unequal access to these social determinants. And that's really what leads to health disparities, right? And this brings me to the second point. Marginalized populations often face systemic barriers, right, that prevent them from achieving good health. So whether it's a marginalized community in the Philippines, right, for example, indigenous peoples, or a marginalized community in the United States, the racialized communities of African Americans, right, they often face these marginalized populations often face these systemic barriers. And what do I mean by systemic barriers? It's these systems that are actually preventing them from achieving good health, whether it's because of political, economic, or again, these social factors that exist in a community. And so usually the marginalized populations are always experiencing poor health outcomes. That's usually the trend that we see. So again, we can talk about indigenous peoples in the Philippines, but also indigenous communities worldwide, even in Canada. There's a lot of indigenous peoples that, when we look at the literature, the studies, it shows that they experience higher rates of chronic diseases, right? And it's a fact, and it's a sad fact, but this is an example of how social determinants of health create these health inequities that we see. And again, you're already familiar, you're already well versed by now on what health equity means. So inequity means we just have an injustice, right? Um, we don't have equal access to healthcare. Not everyone is getting the same supports that they need. And that's why we see a lot of health disparities in these marginalized communities and populations. Okay, so now for the exciting part. What can we do to help address the social determinants of health? So I've just broken this down into three separate steps. Step one, we should advocate for policies that promote equity, justice, and access, right? At a policy level, but also, you might not be a politician, but you still have a voice. You have your part. You can still do it, even at a grassroots or local level. You can advocate for these policies that actually address health inequities that we see, and you see in your own community, right? Step number two, we should invest more in education, affordable housing, and healthcare. And that's really across the board, whether you're in Canada, in the Philippines, United States, this is always a priority. However, in many systems and governments, this is always pushed to the back burner, right? So, you might know about your country and maybe what you're experiencing on the local level. And so, but again, this is how we can address social determinants of health. I envision a world where education is no longer a privilege. Everyone has equal access to education, whether it's access to high school, the master's degree, graduate degree. I envision in a perfect world, right? Of course, we're not living in a perfect world, but really, this is a goal. Everyone should at least be able to finish some form of education that allows them to have access to good health outcomes because of these opportunities that they have, and are given because of their completed education. We should also, again, affordable housing, invest in this, because if we have a lot of people who are living in slums, living on the streets, exposed to unsanitary conditions, this is a problem. We need to invest more in affordable and subsidized housing. Healthcare, right? We got to be careful about this because, if I just say invest in healthcare, okay, put more money into healthcare. But we can look at an example in the United States where the United States is investing so much, they're investing so much in healthcare per capita, right? Their GDP, what they're spending on healthcare is just enormous compared to other places, other countries in the world. However, we see in the United States, this example is that people are not getting the best health outcomes as other countries were spending less on healthcare. And so, investing in healthcare is not always a solution, but investing in in actual healthcare systems that actually provide for people, that's what you need to invest in. Socialized healthcare, where you don't you don't need to have a lot of money to get into the emergency room, like in Canada. However, it's also sometimes a problem in these types of socialized, there's a trade-off because in a lot of cases with socialized care, even in Canada as an example, you have to wait a long line, and sometimes you already have your disease and you're just progressing and getting worse and you're still waiting in line. So there's a lot of trade-offs, right? In the US, for instance, you pay and you get the services you want when you want right away because you have the money. But not everyone has the money, so not everyone can access that. So there's definitely a trade-off. I'm not saying socialized medicine is always perfect, but there's always flaws, imperfections to anything that we design, right? So, but again, investing in good healthcare that is equitable, accessible for all, right? And attainable. Good health is attainable for all. For all, everyone has that same opportunity to actually attain a good health outcome for their physical, mental, and social well-being, right? That's always a good thing to invest in. And finally, we should be strengthening community programs that support, especially those who are underserved and marginalized in our communities. And you can really start this at a community level. Let me emphasize that you can do it at a local level, whether it's you working with your school, doing a food bank or a food drive for those in need, or whether it's working with a local church and fundraising for a lot of social issues, or fundraising for the poor, right? You can support your underserved populations, your communities where these underserved communities where you're living right now. You can do it. Doesn't matter how old you are, but you can do it. You just need a team. All right. So these are three ways that we can address the social determinants of health. And so I know that's a lot of information, but let me give you now a recap of some of the things, the basic things that we've discussed during this lecture. So first is healthcare quality. These are some of the factors. And again, this is an image from Chess Health Solutions. So I've just listed these five things here on this diagram here. There's just five things, and which we've already discussed in great detail, but you can see these broad topics, but also these factors, right? So again, healthcare and quality. Again, these are factors that actually influence the type of quality healthcare you get and whether you have access to it or not, right? So whether you have an insurance covered by your employer, or insurance with your family, if you can actually afford to have insurance coverage. Whether you have education and health literacy, do you have understanding of what health care means, good health care? And again, this is related to education as well, right? Do you have access to transportation, to health facilities? Do you even have healthcare facilities nearby, right? Co-pays, this isn't as important, but and it's essentially part of your insurance coverage. um, if it's being provided through an employer. But again, these are more important, these five. Do you have provider availability, right? Do you have access to a physician? Do you have access to a specialized surgeon, a nurse, take care of you, right? And again, is your healthcare quality good or is it poor? In the neighborhood and built environment, you have these factors. Your housing, do you have safe housing? Is it livable? Do you even have a house? Can you live safe in your house? Do you have access to transportation? Is it safe, right? Is it walkable? Can you actually walk in your neighborhoods and feel safe? Or is it so dangerous that, you might trip on a power line and electrocute yourself? Is it dangerous in that way, right? So walkability. You have parks, areas where you can unwind, recreation, a gym, a pool, an exercise facility. Is the water in your community good quality? Can you actually boil it, and it be potable, right? Can you drink that water and not get sick of any disease? Do you have access to healthy food? Do you have access to these supermarkets, right? So again, this is just a recap of what we've discussed. And again, in your social and community context, are you integrated in your community, your social networks? Do you have support systems? Can you actually engage with your community in a healthy way? Is your community practicing good behaviors, healthy behaviors? Is there a lot of stress? Is there a lot of discrimination in your neighborhoods, right? Economic stability. Do you have enough money? Do you have a good job, right? So it's not, again, just a question of whether you have a job or not, but do you have a good paying job? Do you have a job that supports your health and well-being? Or are you working in an unsafe environment where there's a lot of hazards, safety hazards present, right? Do you have enough income? Is your income enough to support your living for essential needs? Or are you in debt as a result of not having enough income? What do your expenses look like? Are you spending too much on your healthcare that you don't even have enough to provide food on the table for your family? That's a problem. Do you have enough support financially, or are you alone? Do you have family to support you? Um, do you have people that can support you financially or not? That can be a problem. Can you afford to pay your medical bills, right? So an example of this is in the Philippines. It's a law that hospitals cannot detain you, but I've seen this in the private hospital once here in the Philippines where they will not let you out of the private hospital without paying your medical bills, right? They will not let you out. They'll actually keep you in the hospital if you don't pay it in full. There's security guards there and here. And for me, that was quite the experience because that's not the same case in Canada where healthcare is subsidized. But here they actually in some private hospitals they won't let you out unless you pay like a 20,000 peso bill or an 80,000 peso bill, which is like um $1,000, 1,000 Canadian dollars to 2,000 Canadian. So right. So economic stability. And finally, educational access and quality. Do you have access to higher education, right? Because we know already that it's a privilege right now. Um, do you have good literacy skills? Can you understand, comprehend, and translate this knowledge? Do you have access to early childhood education? Do your children have? Um, are you able to comprehend and understand and communicate in your language, right? And you have enough supports for training, for vocational training to actually have better opportunities at work. So there's a lot of factors, and this is not a complete list of these factors within these categories, but in general, it involves really an interrelationship, right? These are not separate categories. I mean, there's separate categories, but they don't exist separate and completely in its own silo, right? They all interact, right? Like economics is related economic stability is related to education, right? Healthcare is related to, again, economics, your finances. And so when we think about social determinants of health, we combine all of these aspects. And if it's like we're doing a checklist, you have good housing, good transportation, good employment, good income. That's actually what essentially the social determinants is, because it all contributes to good health, good well-being, good functioning, good quality of life, and right, high life expectancy, because obviously we all want to live 100 years and beyond, right? Good health outcomes, right? And again, your risk for disease and for mortality, for death, right? So if you always if you all have if you all have a good um understanding of all of these factors, and you check them off, you don't have a high risk of having severe illness or death, because you've checked them off and it's all looking good. So this is really what the social determinants is. It's a way of explaining how all of these different factors combine and interact with each other to provide health outcomes. And obviously, we want to have good health outcomes. So this is why it's important to consider this is the social determinants of health. And so again, social determinants of health, or SDOH, really influences health outcomes. And sometimes it's really more than clinical health care alone, right? I hope I persuaded you with this type of thinking. Again, go back to the statistic that I mentioned previously, that 50% of all of these poor health outcomes can be explained by social and environmental um, factors, right? So again, we're not completely ignoring the biomedical and biological slash physiological model. We're not completely ignoring it, but we're just adding this also important domain to actually explain health outcomes. Addressing these determinants is again very essential for reducing health disparities. If we completely ignore the SDOH and this type of understanding, this type of approach to addressing health outcomes, then we will not see a reduction in health disparities across the board. And again, let me emphasize that together we can always build a healthier and more equitable community when we think about the social determinants of health. So thank you again for watching and for listening. I know it was a lot, but again, thank you. Feel free to include any questions and send me an email if you have any further topics that you want me to delve into. It's again, askrensmph@gmail.com. Thank you for watching, and we'll see you on the next one. Take care, everyone.